Hello everyone, how are you? Great to be here. Hope you've had a lovely lunch and chocolate cake.
Where was the chocolate?
I hope there's a little bit left there for me at the end of this talk. Thank you Cindy and Ruth and all of the team at the Nutrition Academy for asking me to come along today. It's an absolute pleasure to be here and also sharing this stage with some other fantastic speakers. Cindy gave me sort of free rein to talk about whatever I wanted to, really. I think that was the brief. So, of course, talking about things that I'm very passionate about, spine health and functional movement, which I'll elaborate on a little bit more through the talk. But of course, it is a nutrition summit, so I'll throw in a little bit about my experiences in regards to metabolic health as well, and I think that's an important responsibility that every doctor should have. Doesn't matter what specialty you come from. Metabolic health sort of forms the foundation for everything we do in life. So how can you leave that out of a consultation with someone, even if they're coming to talk to you about their headache or spine pain or nerve issues? And I have a little bit of a set here, so you'll find out a little bit about what that's for later. All I need now is a rabbit and a top hat and we'll do some magic tricks. But yeah, I'd like to make the presentation relatively engaging and interactive, so Ruth and Cindy have given me a fairly large time slot. I hope that I don't take up that whole time slot for you guys, but by all means interject and say, hey, I don't know what you're talking about, that doesn't make sense. But I'm also happy to stay back afterwards and do a nice little Q&A if we want to. So we'll get on with it, and let's see if I can get this machine to work. There we go. So what's a neurosurgeon doing talking at a health summit? Well, I touched on that, but there are other people who you wouldn't immediately think should be talking much about nutrition in their daily grind. People who you probably are aware of, and people that I personally know, and that have helped shape my ideas about metabolic health. Dr. Gary Fettke, Professor Tim Noakes, Troy Stapleton, he's a radiologist, okay, so sits in dark rooms all day and he's educating people about nutrition as well. Anthony Shafee is a neurosurgical trainee on the other side of the country, and I've got to know him quite well as well in recent times, doing some fantastic things in the YouTube space, educating people with his platform. And Christine Crono is a friend of mine as well, and she still works with me in my practice in Brisbane. And other than Christine, the other doctors on this list here, you sort of wonder, is it in their skill set to be talking about nutrition and metabolic health? And I say yes because for most of us, our medical training and the medical scientific knowledge that we have, which for me personally spans about 30 years now, when I first started studying medical science, gives us foundations that allow us to understand the basics of metabolic health. And really, when it comes to metabolic health, the fundamentals are really quite simple. You sort of learn those fundamentals in your first semester of university. So just in case anyone's wondering, why is a neurosurgeon talking about nutrition? We do have the medical background and scientific knowledge, biochemistry, physiology to build upon, and it's just having the dedication and the passion to transfer that knowledge to patients. So it's not regarded as our bread and butter, but what I'd like to do is just show a little bit about what I do in my normal daily grind in the operating theatre and in my consultation room. So I'll play a short little video, and I've got a few videos throughout the talk just to take the attention off my voice. So I'll get this one going. So this is called a microdiscectomy surgery, and you can see the patient is positioned on the operating table like that. And what we can see here is what I see down the microscope of my operation, and what I'm doing is removing the prolapse disc, which is compressing a nerve and causing your fairly typical and very well recognised sciatic pain or lower limb neuropathic pain. So this is what's called a craniotomy. In a patient who has a brain tumour, and what we're doing here is we're taking off the cranium with a drill called a craniotome. That's a bit of the skull that's removed, and the tumour is dissected out. And safely preserving the other structures. This is a spinal stabilisation procedure. So in someone who has what's called mechanical instability. But the goal of this is to impart stability to the spine. And this is a neurostimulation procedure that reduces pain that's being transmitted through nerves in the back. I'll just skip that video. Hopefully the video will play a little bit smoother. But as you can see, I wasn't always healthy, okay? This is probably about 10 to 15 years ago, I think I found this photo. And it's probably one of the better photos from that period of my life. I was on my way to type 2 diabetes. I had high blood pressure. I wasn't sleeping well. I was tired. And as I said before, I've had 30 years of medical scientific training, and I still allowed my health and physiology to be hijacked by what I regard as industry conflicts of interest. So if someone with my background can experience poor health, then it's no wonder that people who don't have any medical scientific training can easily be railroaded with their metabolic health as well. And what does that boil down to? It comes down to the media that we see, read, hear, and particularly from what we would consider to be reputable resources of information like NHMRC guidelines. And I was following those guidelines, thinking that all of the medical knowledge and the facts of science were integrated into those guidelines, and if I followed those guidelines, I'd be on the right track. And clearly I wasn't, okay? And it didn't take long, as from the other photograph, it didn't take long to transform metabolic health just by eating in a physiologically sound way. It cost me nothing to do that, and it didn't take very long to just get onto a polar opposite trend line of health. And once you experience that transformation personally, you do become very passionate about the topic, and you do feel like every patient that sits in your waiting room, you feel like you need to educate them and give them that chance at least to make those changes for themselves. Because it really was apparent that the patients that I was seeing with all of those metabolic issues and health issues, chronic disease issues, were not receiving that information from their local doctors. They certainly weren't receiving it from mainstream media and various guidelines from our institutions like the heart foundations and diabetes foundations. Not many patients had heard of things like ketogenesis or nutritional ketosis, So it was just eye-opening that that so many people who were so sick had not even heard of these fundamental principles that would allow them to restore their health. I did feel a lot like I was paddling upstream with these type of issues. I remember talking to hospital executives about producing some educational material. I remember talking to our hospital catering staff and kitchen and trying to make some changes to the diet that our patients were receiving in hospital. So it was sort of very difficult when I'd be educating my patients in my office and then they come in for surgery and then they'd be getting their rice bubbles or wheat bix for breakfast. And they said, well, you just told me that this was all really bad for me and here I am in hospital getting the food that exactly made me sick in the first place. So I did try to make some changes and you do find that you're paddling upstream. And what I say to people now, if you find yourself doing that a lot, you're probably actually doing some good, okay? So don't use that as a bit of an inspiration rather than something that demoralises you. How does this happen? It really happens through what we all understand to be the information superhighway, okay? This is an amazing thing. What is at our fingertips now and on our mobile phones and on our computers at home? We can find out incredible amounts of information about any topic just with a few clicks of a keyboard. But it sort of dawned on me that anything that is really that powerful, that has the power to give people that much knowledge, is also equally potentially harmful with a very dark side. Okay, the information superhighway. And whoever controls this information superhighway, whoever controls this internet-based media world that we live in, can control education and controls the narrative. So you only know what you're allowed to know, really. And this narrative becomes the surrogate truth for people. They don't question it because it's just something that they've heard over and over and over again. And the health crusaders that I listed there, we all have our own stories, okay? We've all come from a place of poor health despite our knowledge. And I'm sure you've all heard of this, the goodness of whole grains, high fibre, low fat, an apple a day. Breakfast is the most important meal of the day. It's like in popular culture. It's like these surrogate dogmatic truths. And really, from a physiological perspective, there is absolutely no basis for these statements at all. Is it complicated to be healthy? Well, we managed to get to the top of the food chain. We're at the top of the animal kingdom. And we did that without apps, university courses. We did that without Christine Cronow's 5 books, Bring Back the Fat. We managed to become the most dominant species and intelligent species on the planet without that. So the answer to that is it's not complicated at all. We just need to eat what's natural to us and what our biochemical and physiological machinery is designed to do. And really that boils down to one very simple concept, and that's to maintain insulin sensitivity. And I've coined the term the life diet because it's really simple. Low insulinemic food for everyone. And that makes it even more simple to say, well, what will spike my insulin? And that is glucose and other carbohydrates. So if you avoid glucose and other carbohydrates, it only really leaves fat and protein, okay? Because there's only 3 types of food: carbohydrate, fat, and protein. And if you go by the life diet, the dominant macronutrients in your diet should be fat and protein. So that makes it even simpler. Nose to tail, flesh is the most nutrient-dense food source. And if you do that, all of the stuff that I do consider quite complex, the micronutrient ratios, it kind of balances out for you. You don't have to think too hard because the animal has already done the formulation for you when you eat their flesh. Okay. Sarcopenia means loss of skeletal muscle bulk, or the numbers of fibres and the size of fibres, and it's very prevalent in our society. It really equates to organ failure, and that organ being the muscular system. Okay, and there are many, many people walking around. I can spot it just walking in the shopping centre with sarcopenia, and they have muscle failure, they have organ failure, and if you said to them, you know, or if you had someone who had kidney failure or heart failure or liver failure, you would think, oh, that's terrible, that's a horrible thing to have, that poor person. But there's literally millions of people walking around who have muscle failure, and that's no different to those other organ systems that are failing, because that very powerfully affects our insulin sensitivity. And other factors as well, such as osteoporosis, which is prevalent, and your ability to engage in life's activities, okay, quality of life, sarcopenia. But the most profound thing is that sarcopenia is so easily preventable. And how is it prevented? It's prevented by moving, and I like to qualify that with not just moving, but moving well, okay? Think about the human vehicle that moves and moves well. It's not just about driving a vehicle from A to B, because we can all kind of do that, but we want to drive our vehicles from A to B in a very proficient way to make it safe for us to get there, right? So move...
Sorry, because we're hoping that's going to fix the video.
Oh, okay, sure. So, yeah, if you have a lovely Mercedes or a BMW, you don't just drive it around, you drive it well to avoid having car crashes. So think about your human body as being a vehicle as well. It's the most valuable and important vehicle that you can possess. So you want to move that well. But we've also got to define for people, unfortunately, nowadays, we have to define for people what moving well means. Is it one slide back?
Testing 1, 2, 3.
This one's good.
We're just hoping this will fix it.
Okay. Oh, is it? Okay. Oh, I might be talking a bit loud. Okay. Is there a battery on that one too? That's okay? Okay. Hello? Testing. Hello? Now just go, I'll go back a couple of slides. Yep. Testing. Hello? Testing. Hello? Hello? Okay, can you hear me? I can talk a bit louder into this microphone. So, let's have a think about what modern medicine has achieved today. Now, neurosurgery is considered a fairly pointy end of the spear in terms of medical science, and for sure, modern medicine plays a massive part in my occupation. And every year we come out with amazing, miraculous achievements in intensive care and surgical equipment, radiology, pharmaceutics, robotics. We're starting to do spine surgery with robots now, and that allows us to be very minimally invasive in terms of tissue dissection, and all of those things are fantastic. And our patients who unfortunately develop malignancies, chemotherapy, radiotherapy advances are incredible, and they do provide a lot of health benefits. But the key point in this slide is that all of these modern marvels of modern medicine, they really only account for about 10% of the total burden of disease that society sees. 10%. So the other 90% of our total burden of disease is made up of chronic disease. And why does modern medicine do so poorly at managing chronic disease? Well, it really boils down to the dollar, and it is, you have to be a little bit cynical, but where does the commercial interest lie? Real health is not a great business model. Real health cannot be purchased, and the pillars of health are free, okay? And then we start to think, well, what are these pillars of health that are free that industry cannot make much money from? And then we start to realise why chronic disease burden is so massive. Chronic disease costs us about $98 billion a year, okay? And to put that into perspective, building a new hospital, and on our drive-in today we saw a new hospital being built. A massive tertiary care hospital probably costs about $2.5 billion to build, and maybe another $500 million or $1 billion to resource. So chronic disease is $100 billion, okay? And what happens to that $100 billion? Where does it go? Well, again, not to be cynical, but there are many organisations that are going to tap into this $100 billion industry, okay? It is not in their interest. It is not in their interest to promote the simple, free pillars of health. Many organisations would go completely bankrupt without that 90% burden of disease, of chronic disease. So these are what I refer to as our 4 free pillars of health. And I always qualify it with quality nutrition, okay, quality movement, quality sleep, and stress management. Okay, a little bit of stress is okay, but there's the difference between good stress and bad stress. And if we all understood this, and this very simple message was promoted far and wide and became part of the narrative, then all these chronic diseases that make up that 90% would effectively disappear. And we actually wouldn't really need the $3 billion hospitals as much as we do now. And there it is. Every day we walk out of our homes and we see the public and they are eating poorly. I see people, because that's what my eyes are focused on, is movement. And I see people moving poorly all the time, accelerating their musculoskeletal disease, poor sleep, and exposure to many, many stresses in our lives, in particular social media, which then drives up bad stress, okay. So I'll spend a little bit of time talking about movement now. I really want you to not get confused by a movement versus exercise. It's mandatory for musculoskeletal health to move well, okay, but it's discretionary to exercise for athleticism. Not everyone needs to be athletic. Not everyone wants to be athletic, and there is no need to be athletic. You need to have the athleticism to live the lifestyle that you want. And if you want to have a lifestyle that involves waking up in the morning, making a cup of coffee, doing a bit of gardening, doing some shopping and housework, and going to your normal day job, which may be an office job, you don't need to be very athletic. If you want to climb Mount Everest and go kayaking and surfing, then there's an element of athleticism that needs to be integrated into your lifestyle. Okay, so, but in order to maintain musculoskeletal health, whichever camp you sit in, moving well is mandatory. So think about it a little bit like building your house. Quality functional movement is like the concrete slab. Okay, that's essential. And what you build on that concrete slab, whether it's a little shed or whether it's a palace, that's then your personal choice, okay? But you can't be healthy without first understanding what quality functional movement is, and that's the concrete slab. Exercise is a massively growing industry. There are gyms on every street corner. They're usually open for 24 hours a day. There are online apps that let you exercise in your lounge room. It is a massive growth industry. We've never exercised more than before as a society. And our musculoskeletal health has never been poorer than before. Okay, so it's very clear that exercise is not the answer, and there's a very big difference between exercising and quality functional movement. So I need a show of hands now. Who's a golfer in the audience? There we go. We've got a couple of golfers. Oh, that's wonderful. All right. Who wants to admit what their handicap is?
Yeah, the GA of 22.
22, that's pretty good. And how long have you been playing?
About 12 years.
12 years. So when you first started playing golf and you thought, oh, I really like this game, I want to get better at it, what did you do?
Oh, I went to the professional.
You went to a golf coach. Fabulous. Now, the sport of golf, there's about 8 hands that went up. Is it a discretionary choice? You like golf. Let's think about our lives as a sport, okay? And so I coined this term, the sport of life, be good at it. And in order to be good at a sport, if you really want to be good at it, you get a coach. Now, sadly, in our society, most people are actually very bad at the sport of life. And in order to be good at the sport of life, you really need a movement coach. And has anyone heard of a movement coach? Not really. I mean, there may be a few, yeah. But as a general rule, we've heard of personal trainers and we've heard of physical therapists and all of the rest of it, but we haven't really heard of a profession of movement therapists, okay? And I think that's one of the key things that I'm working on moving forward to make people understand that there is a profession and there is a skill set of people who are regarded as movement therapists. And why do we need that? Even though movement is innate, okay, a baby goes from lying in their crib and then starting to commando crawl, and then they get up on their hands and knees and crawl, and then they slowly pull themselves up, and then they're racing around like maniacs, right? That's naturally hardwired into them. They haven't done any course or read any books to do that. But modern society does corrupt that over time. So how bad is the state of musculoskeletal health in our society? Well, if you believe anything the World Health Organization says, and I used to, low back pain is a major global challenge, okay? It's getting worse rather than getting better. And it's not just something that affects older people, okay? It affects people in the prime of their life, in the prime of their working life. And our own Bureau of Statistics and Australian health data is quite eye-opening, because we track the major diseases that are contributing to disease burden. And what I've got on the slide there, ignore most of the words there, but the main thing I want you to see is that in 2003, we had coronary heart disease as one of the leading causes of disability. And then we compared that with data from 2018, and it got better. It improved. It's still number one, but good old back pain is number two. All right? And if you compare back pain in 2018 to 2003, it's got worse. It's got worse, despite all of those amazing modern marvels and technological advances and gyms opening on every street corner. So that was really amazing when I read that, and the data was from 03 to 2018, but it was only published last year, and it's really motivated me to start, pulling my socks up and get working a little bit harder on this. And think about it, in terms of back pain, just can I get a show of hands of how many people have had niggly back pain in their lives? How many? That's a lot, right? That's a lot, and that's kind of consistent with the statistics. And if you type into that bastion of knowledge, Google, and type in "how do I fix my back pain," you get endless scrolling, and you can see massage therapists, chiropractors, osteopaths, physiotherapists, musculoskeletal physicians, neurosurgeons, spinal surgeons, and they are all in the industry of treating back pain. And that's kind of one of the problems, is that there are many, many people that are treating back pain, but back pain is a symptom. There is almost nobody treating the cause of back pain, okay? And that's a big problem. And with any condition, any medical condition, if you have a paradigm that just manages the symptoms and ignores the cause, that intervention will ultimately fail. You may alleviate symptoms for a little while because it is a symptom-based approach, but if the root cause of the problem is not resolved, it will rear its ugly head again and start to cause symptoms. And interestingly, it ties in very nicely. The parallels with metabolic health and nutritional health are very similar. They're the two of the few conditions in medicine where the industry is quite happy to manage the symptoms. Think about what we do for diabetics and things, but ignore the cause, okay? And this would never happen in fields like transplant surgery, okay? So imagine that you've got emphysema and you need new lungs, or you've got cirrhosis and you need a new liver, and the transplant surgeon would never give you a new lung or a new liver if you were still smoking or drinking, because the smoking and drinking is the problem that caused it in the first place. You just wouldn't be on a transplant list. Okay, but when it comes to musculoskeletal health and metabolic health, the industry is still very happy for you to be consuming glucose, which you're intolerant to, or moving with poor quality, despite you being a victim of that cause. And this is an example of it. This is a study published in the Lancet. It's a little rag called the Lancet, and there's three professors on the authorship, and I find it quite incredible that you'd put your name to such a statement. So we already know that back pain is one of the leading causes of disability on the planet. But you've in the third line of your research paper, you've admitted that there is no cause for it. Okay, and that just makes no logical sense to me. And I see it all the time in my medico-legal work and insurance work. I see certificates, and these pieces of paper are going to be held up in court for a judge to determine. And the diagnosis is quite often listed as back pain. Okay, back pain. It's a symptom. Back pain is a symptom. You cannot use a symptom interchangeably with a diagnosis. Okay, so they don't actually even recognise a diagnosis for one of the leading causes of disability on the planet. So what is the disease then, I'm sure you're asking, that causes back pain symptoms? But before we get there, what is the back? Okay, the back is simply part of our spinal column. What is the spinal column? It's a series of joints layered on top of each other. And what's the spinal column for? Okay, It's for support of our viscera, our torso and our abdomen. And it allows us to move in space. It allows us to transfer energy from our hip extensors and our lower limbs to our upper body and to move in space. And what determines the health of the spine? So the most significant factor that determines the health of a joint is the way it moves, okay? Very simple, non-conjectural, okay? I'll just demonstrate. If I walk around, I want you to look at my ankle. Can you see my ankle? Okay, so I'm just walking around here. I'm moving my ankle, I'm walking. But clearly, you guys probably aren't orthopedic ankle surgeons, right? But you can see very clearly that the way I'm moving my joint is not correct. It's dysfunctional, okay? So what's going to happen to my joint if I keep walking like that? It's going to be compromised by the biomechanical. I'm going to do that. Put it right now because that hurts. But it's going to be compromised by the biomechanical stress, because biomechanical stress transfers to biological inflammation. Inflammation, as we know, is painful and harmful, and you will eventually get structural changes as a consequence of persistent inflammation, chronic inflammation. Okay, so it's quite a simple concept that spinal joints become unhealthy if we don't move them well. Okay. So the primary function of the musculoskeletal system is movement, and a failure of that system, by definition, means that we have a disease called movement dysfunction. All right. So what I want to do is demonstrate movement dysfunction. So who would like to come up on stage, and we're going to do a quick diagnosis of movement dysfunction. Who's keen? Okay, come on up. Now what I want you to do, give her a little bit of a clap. You're very brave. She looks quite, hello, what's your name?
Annabelle.
Annabelle. Annabelle looks very athletic, healthy, supremely healthy. So I want you to stand side on so that the audience can see. So we're going to focus on these guys. These guys can be the judge. Side on, facing me. Okay, so what I want you to do is just imagine that you've just been bitten by a bumblebee on your left kneecap, okay? You've just been bitten, and I just want you to scratch your kneecap. Excellent. Okay, fantastic. Did you all see that? How did you think that looked? Yeah, pretty. Okay, so that's test number one. That's test number one. Now I've got my other little props here. And what I'd like to do, let's put that down. So, hang on, let's put that down too. What I'd like you to do now is, again, sitting side on so the audience can see.
Sit down.
Yeah, I just want you to sit down. Excellent. Just watch her sit down, and I want you to watch her stand up. So just stand up again. Yep, and have a sit down again. Okay, nice. Okay, fantastic. That's test number 2, all right? And this is our third test. This is the most difficult of all. You can stand up again and come and stand over here. Fantastic. So here I've got a very simple water bottle. Okay, now I want you to think that, yes, the water bottle is stuck to the table. Actually, I'm going to change something. Made it too easy for her. Okay, so that's sort of like a standard height of a coffee table, maybe a tiny bit lower. But certainly picking that up wouldn't be something out of the ordinary for you, would it? But that particular bottle is stuck to the table, so you can't just lift it up. And what I want you to do, and I want everyone to watch, is Annabelle taking the lid off the water bottle. Okay, can you do that for us? Fantastic. And pop the lid back on. Good. Superb. Okay, that's it. The test is done. All 3 done. Fantastic. Have a seat. Thank you. And I'll let you know. We'll go through. I won't tell Annabelle whether she's passed or not, or whether she's got this new diagnosis that she needs to urgently go and see a movement therapist about. But maybe you'll all be able to assess that yourselves later as we proceed through the talk. So thank you so much for that, Annabelle. That was a great demonstration. Exactly what I wanted you to do. So that's my definition of movement dysfunction, okay? It's an acquired, ubiquitous, it's everywhere, functional disease of modern industrialised lifestyle manifesting with musculoskeletal pain, disability and structural compromise. And we can see that as we begin our life journey, little toddler, there's really no movement dysfunction at all, okay? And we can see when we go to non-industrialised civilizations and cultures and parts of the world which are slowly shrinking and becoming non-existent, that we also don't suffer from movement dysfunction. But when we walk around the shops, when we take a wander through suburban Australia, movement dysfunction is everywhere. Okay, and that may not look unusual to you, but to a movement therapist, that is clear movement dysfunction. Okay. So we talked about the golf coach, and when you went to your golf coach, you would have spent half an hour, 45 minutes, maybe once a week for a period, a month or two. And what type of things did the golf coach convey to you? Like, I mean, it's a long time ago now, but just say you were coaching.
It's not a long time, because I have to have them fairly regularly.
Yeah.
Basically, you are right. It's about the swing and the movement of the body.
Yeah, they will give you movement cues, right? They'll, from someone who has never held a golf club before, they might say, well, this is how you hold a golf club. This is how you stand. This is how you bend your hips. Okay, so they're very, very specific rules to be good at golf. And then you practice those rules. And so this is what I've synthesized down over many years to be good at the sport of life. Okay, there's 7 rules. Okay, that's not many rules. There's more rules for Monopoly. And there's 7 rules here that allow you to be good at the sport of life, one of the most important sports of all time, because we're all participating in it. Okay, there's no, you don't get a choice. If you get out of bed in the morning, you're playing the sport of life. Okay, so they're the 7 rules, and I might go through those with another demonstration. Does anyone want to demonstrate? I might get Joanne, my other half, to come out here. Joanne's my wife. She's an integral part of our rehabilitation. So we're going to go through those 7 rules. We'll go through the rule 1, 2, 3, 4 rules here. So Joe, can you just demonstrate how you would scratch your knees? Fantastic. And now demonstrate side on again how you would open the water bottle lid. Fantastic. Okay, so now we're going to correlate that with my little stick here. That's not what you think it's for, don't worry. Did we just lose that? It's back on? Okay. So you can see rule number 1 is hip-centric rotation, okay? So right here, Jo has her hip joint, which is a ball and socket joint, okay? If we dissect it out, it's a ball and socket joint. So I've got the broomstick here up against her thoracic spine and down here on her sacrum. And if you demonstrate hip-centric rotation for us, Jo. Fantastic. Okay, so the spine, there's no intra-lumbar flexion going on. The spine is maintained in what we refer to as a neutral position. Some people say a straight spine, but it's effectively not straight. There's a slight shallow curve in it. The 100% of the rotation occurs through the hip joint. Okay, And so that just means we don't want to round our lumbar spine, okay? And then the other thing that we can notice, so that covers neutral spine and hip-centric rotation. And then the other thing that we want to notice is as Jo, say she does a lower hinge, go a bit lower, so stop there, Jo. Where do you feel the muscle activation engaging?
You're asking me?
Yeah, yeah. So it's in what we call the posterior kinetic chain, okay, the posterior kinetic chains. And the posterior kinetic chain, I can dissect that out of a cadaver. The posterior kinetic chain runs from the sole of your foot, up the calf, up the back of the hamstrings, into the glutes, up the back of the spine, and it actually stops in the top of the head. Okay, so that is the posterior kinetic chain. It is a musculoligamentous tendinous band of tissue that creates potential energy and kinetic energy for propulsion. Okay, so when Jo did that movement, she was using her posterior kinetic chain. And the posterior kinetic chain lives in the back half of our body. And where do you think the spine lives? It's in the back half of our body. So we want to optimize the health of the posterior kinetic chain in our daily movement activities. Okay, so there's number 3 rule, engaged, tick. Now, if you demonstrate it again, Jo, side on. So when you lean forward again, now what we're doing here, do you feel any tension in your knees as compared to if your knees drove forward and you did a kneel? Okay, look at that position versus that position. Which one do you think would create more biomechanical stress on the knee joint? Yeah, the kneel, right? That's what we call a kneel. And that is not good movement. And one of the second most common operations in our hospital is knee surgery. So we don't want to maintain rule 1 and 2 and 3, but break rule 4. Because I sort of can do that. Can you demonstrate that again? So we've done rule 1, 2, but then we've broken rule 4. Okay. So if we do it like this, okay, then we've maintained all 4 points of performance there. Rule 1, 2, 3, 4 ticked off. And then we're going to skip the shoulder girdle because that's moving to the upper spine. Number 6, proficiency limited range of motion. So let's imagine that this is on the ground now, okay? So Jo's got to do the water bottle test with rule 1, 2, 3, rule 1, 2, 3, 4 engage, but let's imagine that you can't hip hinge the whole way. So do it again, and now that's stopped. Okay, so just imagine that that's the limit of her hamstring conditioning. Okay, so she can't go any more without breaking. So imagine you're going to break the rules now, and now she has to round. Okay, so we don't break the rules 1, 2, 3, 4 in order to do a task that's beyond our current state of musculoskeletal health. What will happen is that as time goes on, if she modifies her movements and just tries to not do tasks that are beyond her capacity, that the condition of the tissues will improve. And then, now you can do a hip hinge and actually do the task. Okay, and now she's doing it proficiently. All the points of performance are maintained because Jo's been moving well for a very long time, so her range of motion is very good. If I said pick up a 5-cent coin off the ground, maybe it would start to reach that threshold of performance ability that she might be breaking the rules a bit. So you're not allowed to pick up coins off the ground. Okay, fantastic. Thank you for that. I hope that made sense. It's a little bit. That's the easiest way that I can demonstrate that there are definitely rules for this sport of life that is so important, and it's not always natural. And I think Annabelle was pretty good. Maybe the knee scratch test was probably the least proficient. And when you did the sit to stand, it was quite good. There was a little bit of knee loading on the sit to stand. And when you did the water bottle test, you were pretty good actually. You sort of dropped into nice positions. But when I gave you that really simple task of knee scratching, you sort of just, oh, that's an easy test, I can do that. And you just went straight into that position, which is breaking, it's definitely breaking rule 2, okay, and you're sort of deactivating the posterior chain. That knee scratch test, that's an opportunity to restore health to that posterior kinetic chain. Okay, so you want to seize on every movement opportunity in life that drives health back into the system, so that when you are faced with a challenge of picking up a 5-cent coin off the ground, boom, you can do it, okay, because you've been doing it so well for every other default movement that the tissues are super healthy, and bang, anything that life throws at you, you're going to do proficiently. Okay, I hope this video works. Where's our IT man? I hope so. So this is a video, it goes about 4 minutes. If it's a bit scratchy, I'll just stop it. But it really talks about a concept that I've termed unevolved evolution. And it really does make us understand why, as human beings, we are so susceptible to spine-related pain.
Here are humans doing things that they're not meant to be doing.
For the past year, their existence has been known to just a handful of experts who have been sworn to secrecy. When I heard of it myself, I was intrigued, but nothing prepared me for the reality. Now, finally, the secret can be revealed. There are 4 girls and 1 young man. Hussein has walked like this for 28 years.
Very revealing for anthropologists, people who study early human evolution, because what these children have done is to reinvent or rediscover a form of locomotion which very likely does correspond pretty closely to the way our ancestors walked.
If we extrapolate this to elite level functional movement, such as Olympic weightlifting, which requires perfection in movement technique to move heavy loads large distances very quickly, you appreciate the same biomechanical principles in action: hip-centric rotation, neutral spine awareness, posterior kinetic chain powered movement, unloaded knee positions are all clearly visible. Now let's observe the same movement points of performance being expressed in a beautiful creature that is transitioning between quadruped and bipedal movement. So here's our ancient ancestor, 4 million years ago, squatting down, neutral spine position, hip-centric rotation, posterior kinetic chain, engaged, unloaded knee positions. Just perfect biomechanics. And now he's moving like a quadruped. Again, neutral spine position, hip-centric rotation. You can see the large gluteus maximus and the posterior kinetic chain developed for movement. Here's his friend, and again, perfect movement points of performance expressed all of the time. Now he's walking upright. You can see he's a biped now, but he's still maintaining those movement points of performance that we as human beings should also be maintaining throughout our everyday life activities, because our anatomy is designed for that type of movement. Many people okay, so that it really highlights this concept that we have evolved to go from quadrupedal locomotion to bipedal locomotion. That is most definitely an evolutionary change over the last 4 million years, but the anatomy has not evolved with it. So our spinopelvic anatomy, is the same effectively as our 4 million year old ancestry. Okay, and when we moved as a quadruped, almost all of the time we would have been adhering to those movement points of performance that we were demonstrating up here. So going from into living in a modern society that we have now, it's really just pulled the trigger, so to speak, on our susceptibility and exposure to developing movement dysfunction. We can't take ourselves out of modern society. We can't force evolve our spinopelvic anatomy, and we're not going to suddenly start walking on all fours. But functional movement therapy and understanding what that is will allow us to resolve those barriers that are causing so much musculoskeletal pain in our society. And so what does it look like? Clearly, movement dysfunction, mum bending over, similar to the scratching the knee test. There it is. You can see that the lumbar spine neutrality is gone. There it is, the deactivation of the posterior chain, loading of the knees. And this is what we see all day, every day, if you're actually looking out for it and able to define it. What happens to our joints when we move well? Well, there's less inflammation. We don't need to take our Nurofen, our Panadol. There's less muscle tightness, okay? When your muscles feel tight, when you have spine pain, your muscles are just doing what they're meant to do. Okay, that's what muscles are meant to do. They're meant to get tight. They are contractile structures, and they are contracting as a compensation, as a defense mechanism, as a normal reflex to pain. So just receiving the massage and releasing those tight muscles is not the solution. It's not the definitive solution. You're just trying to undo something that's a natural protective mechanism. And of course, you experience less pain and disability very, very quickly. Your quality of life improves. You can build your capacity and athleticism, mitigate ever having to see a spinal surgeon. And our bodies should have a 100-year warranty, okay? We have a 100-year warranty on our bodies. You shouldn't need to get a refund or anything before 100 years. All right, now this is my travels to northern China, and I was just absolutely gobsmacked when I saw this place. It's in rural China, and once you get out of the main cities, you see movement proficiency everywhere. Okay, this is amazing when I visited this place. Have a look at this. Hello everybody, David Johnson here, spinal neurosurgeon from the Functional Movement Training Centre. I was really excited when I came across some of this old footage of mine from a trip that I'd made to northern China a couple of years ago, and I was amazed watching it again and really excited to show it to our Functional Movement Training Centre community, because it hits home a very important message. Number one, that age and degeneration do not equate to pain and disability. Do these elderly Chinese folks have degenerative discs and facet joints? Absolutely. If I put these people into an MRI machine, I would see the same lumbar degeneration that I see in my patients who are suffering from chronic low back pain. Do they look like they are suffering from poor functional capacity or movement deficiency? Absolutely not. Do we see our elderly community in Australia doing similar functional movement? No, absolutely not. I've never seen a park like this in Australia. These parks like this were scattered all over the countryside in rural China, and this was a cultural activity that was engaged in every day. We have good evidence now that supports low back pain being one of the world's leading cause of disability, and this is seen predominantly in industrialised nations. We don't see this in non-industrialised cultures. Now, this is primarily because these folks retain their movement proficiency from childhood right through until they die. And it's not because of doctors or physical therapists or medications or surgical technology. It's because they maintain the elements of movement proficiency, mobility, coordination and strength, and these make up the elements of good movement, and this is the primary goal of the teachings at the Functional Movement Training Centre and the NeuroHAB program that we offer. Okay, you get the idea. So the next question would be, if I want to improve my musculoskeletal health, and in particular if I suffer from chronic back pain or niggling back pain that's coming and going, and each time it comes and goes it lasts a little bit longer, hurts a little bit more, and you know, I don't ever feel like I get back to how I was 6 months ago. How do I teach? This is a cohort of people that I look after, and I'll show you a video of us actually teaching people how to move correctly again. This is what we do every day at our facility in Brisbane. Many people ask, what is NeuroHAB functional movement therapy? The fact that so many people don't know about movement therapy reflects how scarcely available it is. The Back Pain Centre is the only organisation delivering specific and distinctive NeuroHAB movement therapy in Australia, and many patients, after completing the course, are disappointed that they weren't directed towards movement therapy years earlier when they first started experiencing back pain. Movement therapy is very simple, really. Simplicity is what drives the efficacy and the results of NeuroHAB. Movement therapy strives to educate patients that there is a good and bad way to move. NeuroHAB defines the rules of movement for patients to learn, and our expert movement therapists transfer those skills to patients, relentlessly chasing virtuosity, making you, our patients, exceptionally good at the unexceptional movement activities of daily living. Why is this so important? Because the spine is a series of joints aligned on top of each other, and undeniably the most significant factor that determines joint health is how well it moves. NeuroHAB is not focused on exercise, core strengthening, stretching, adjustments or deep tissue release. These approaches have already failed millions of back pain sufferers and have proven limited long-term benefit. At NeuroHAB Functional Movement Therapy, you will never be laid on a couch, you will never be massaged, but you will become more skillful at controlling your human vehicle. And skillful control of any vehicle, regardless of whether it's biological, like the human body, or mechanical, like a motor car, is critical for its sound performance. Okay, so it's very simple. The way we teach people how to move correctly is very simple. It's progressive. It takes a little while, just like your golf classes. You know, it takes a while to become proficient and automatic or default with your motor patterns, but it's also extremely enjoyable. So my patients who have had years of chronic pain, one of the most common things they say to me is, why didn't I do this right at the beginning of my journey? Why did I have to wait 10 years? Why did I lose my job and become addicted to opioids through this process? I've talked about movement proficiency and defined that as best I can. What about functional movement versus non-functional movement? There are key characteristics that define a functional movement versus a non-functional movement, and we all engage in a lot of activities like walking, cycling, swimming, jogging. These are some of the most common pastimes that we do for fun, health, leisure, fitness. But in actual fact, they don't often have many criteria that meet the definition of a functional movement. So if we define the characteristics, they are natural and hardwired into our DNA. They are compound, meaning that a functional movement typically makes your body move multiple joints at the same time. And in doing so, we're actually recruiting a large amount of muscle fibers. The range of motion of a functional movement is generally greater than a non-functional movement. The expression of power is from the core, so the centrally located muscles, to the extremity. And that velocity of movement tends to be central to peripheral, a little bit like a whip cracking. If you think about the way that a whip cracks, the handle is the power, and it flows from central to peripheral, and the acceleration of movement in a whip cracking goes from central to peripheral, and that's one of the characteristics of a functional movement. It's inherently powerful. And by virtue of that power, it can only really be sustained for a short period of time. So if you're doing an exercise session for athleticism that's longer than 10 to 15 minutes, you're probably not doing a functional movement task. And it represents the most efficient and natural way to move heavy objects, large distances quickly. And one of the most important elements of a functional movement is that it promotes neurohormonal secretion of adaptive anabolic ready state hormones. And that's really important, is if we're trying to drive physiological metabolic changes, we do that through the stimulation of hormones, okay? And these are good hormones, and hence the utilization of functional movement for metabolic health. It clearly improves musculoskeletal and physical benefit, but it is synergistic with our metabolic health. And as I said, it promotes those hormonal secretions. If I take a blood test in someone who's spending 15 minutes doing a non-functional movement versus a blood test immediately after someone's done 15 minutes of functional movement, and I measure for these stimulating hormones and growth hormones and many other factors that are all health driving and health enriching, they'll be extremely contrasting, and that's been done. And so if we're spending lots and lots of our time doing non-functional movements, then you can probably achieve far superior health benefits from spending a short amount of time doing functional movements. Here's the champion of the Gold Coast Marathon, okay, and that requires extreme adaptation to running for hours and hours, okay, and you can see the consequences of that type of athleticism. The human body adapts for that single task of running a sub 2 hour 42 kilometers, okay. And it's not necessarily healthy. He's very good at that one task. If you contrast that with the physique of someone who just decides to do a little bit of functional movement for 6 months, whereby we sprint, we lift, carry, pull, push, we jump, swing and climb, okay? These are all functional movements versus running, which is really not a functional movement, running long distances like that. You can see the difference in the physique of the human being. All right, we're coming down to one of our last slides here, and it's a little bit, I might skip through this, it's a bit long-winded, but the point of this video is just to highlight that functional movements are for anyone and everyone. You don't need a gym membership, you don't need to pay a lot of money. You probably do need someone to give you some guidance in the very beginning of your functional movement journey, and and there's no restrictions on where to start, okay? So this video will just contrast someone who's trying to do functional movement and movement proficiency for athleticism versus someone who's just doing it purely for health. Good morning, David Johnson here at the Functional Movement Training Centre. The purpose of this video is really to give you a quick overview of how we can incorporate movement proficiency combined with functional movements to build musculoskeletal health and metabolic health, and ultimately build functional capacity, which I think is an alternative way and an alternative metric of health. And I think it's a very superior metric of health, functional capacity, because functional capacity means what can you do in life. And if you can do lots of things in life, then all of the other metrics that we commonly measure to determine health will be trending in the right direction. So regardless of whether you're in a setting like this, which is clearly designed to allow people to build a very high level of capacity and athleticism, or whether you are in your lounge room at home and you have simple objects like a backpack, and some water bottles, and I just pinched a few things out of my own house, you know, something with a little bit of weight that's nice and compact. You don't have to spend a lot of money to allow your body to gain from the expression in your daily life activities from functional movement and movement proficiency. So the key elements that I want to just go through that allow you to develop your whole body's musculoskeletal health is really pushing movements, pulling movements, squatting movements, and hinging movements. And then once you've got those under control, then you can sort of mix them all up, and you can create little drills and short little sessions of functional movement training. And I think you'll get a lot of enjoyment and a lot of health benefits out of that type of approach to your musculoskeletal and metabolic health. So I'm going to just go from a more athletic demonstration to an equivalent demonstration if you're just starting to think about gaining musculoskeletal health and you've never done any physical training per se in your life. So if you're just stepping into this arena for the very first time, the same principles will apply, and you'll see similarities in the movement because they are the same movement, they're just at relatively different levels of intensity. So firstly, we're going to do a push movement. So with an athlete, so if you've already done a lot of sport in your life and you have a relatively high level of capacity and you're just trying to maintain or progress in your understanding of movement proficiency and functional movements, a push movement may be something like a barbell push, a barbell press. Okay, so from this position, 1, 2. Okay, so what's the equivalent of that? Now, you will notice that I'll start to get a little bit breathless with some of these activities because they are functional movements. One of the characteristics of a functional movement is it is intense, and so therefore a consequence of intensity is breathlessness. So what could you do at home? A couple of drink bottles. Okay, straight in front, elbows in front, shoulders high. 1, 2. Okay, fill them up with some water, leave them empty, whatever it may be. Let's think about the pulling movement. So a very simple movement for pulling would be, for an athlete, would be a pull-up. Okay, so if you're in a gymnasium setting, you can do a strict pull-up. Okay, if you've got access to the barbell, you can do pulls such as bent over rows. Okay, and if you are stepping into it for the first time, what could you do to simulate a pulling movement? You could do a cheap $5 band, and you could do various types of pulling movements. Okay, pulling movements like that. Okay, and various other types of pulling movements. Okay, other side. All right, and you can do lots and lots of different types of movement tasks with the resistance of a rubber band. You can also use your water bottles again, and you can do bent over rows with water bottles. Okay, now it's very important that when you start out that you do try to get someone teaching you how to get into the positions to do the movement correctly and utilize the correct muscles. Because as you know from the previous slides, functional movements are very much characterized by quarter extremity delivery of the power, compound movement, a lot of muscles working at once. So like when I did that pull-up, it wasn't just my shoulders and my back muscles doing the work. It was every part of my body engaged and remaining active to do the movement. So now, squatting movements, okay? We want to be able to allow our body to move through these wide range of motions. That's why we have joints. That's why we have a ball and socket joint, because we want to allow our body to move through wide ranges of motion. And that's one of the characteristics of a functional movement. So we can do in the gym setting, we can do what's called a front squat. Okay. Or the barbell might be in our back position, and we'll do a back squat. Okay, and whether the barbell's in the front position or the back position will activate slightly different parts of the musculature. And of course, an even more challenging type of movement is called the overhead squat. Okay, so what are you going to do if you don't have that potential or that capacity yet? You're going to just do simple air squats. Okay, again, you need someone to teach you how to do the movement correctly, and sometimes it's very useful to have a target to guide your range of motion. Okay, so we might use a kitchen chair or a ledge, and we just do our squats to a target. Stand up tall, sit down. Okay, everyone can do this. There is no limit, there is no restriction on anyone being able to do simple body weight squats to target. And then as you get more proficient, you then go, all right, that's pretty easy. I'm going to lower the target. Okay, and that becomes easy too as your musculoskeletal system gets healthier as a consequence of doing this movement as default movement pattern. So when you sit down to have dinner, you do the exact same thing. And then eventually you say, I don't really need the box. I can just do a really nice air squat without the need for the target. As you're gaining capacity, you then start to add in little loads. Okay, so all right, let's do that. If the shoulders aren't up to that capacity, you don't have to hold them in this position. Hold them in this position. Okay, and as you're getting even stronger, we go, rightio, let's put on a backpack. Everyone's got a backpack at home. You don't need to have anything fancy. Fill it up with some goods to add a little bit of weight to it. Start doing our air squats with a load, and then progress. Okay, so there's no reason why you can't continue to build capacity in a slow, progressive manner. Other little weights that you can use. Okay, so you can use these weights and do what we call, normally we'd use a kettlebell or something like that to get really heavy loads, but this is absolutely perfect as you're starting out to do what we call goblet squats. Okay, goblet squats. So that's just squatting, and then so the squatting really has the purpose of allowing you to get nice deep ranges of motion so that you can pick things up off the ground. It really loads heavily all of those muscles that stabilize the spine, the quadriceps muscles, the back muscles, the core, front core muscles, the glute muscles. But then there's another movement that really isolates what's called the posterior kinetic chain, which runs from the back of the lower limb, up your back, up your thoracic spine into your cervical spine, and that kinetic chain ends up here in the top of your head, and hinging movements really activate that. Critically important, keeping the knees, limiting the knees driving forward, because that deactivates the posterior chain, and pushing your hips back, like some of those other videos that I've shown in this talk, and maintaining that active position of the posterior kinetic chain. What's the classic movement for that in the athletic arena? It's called a good old deadlift. Tried and tested, proven to be an extremely powerful movement for developing that posterior kinetic chain health and power. And if you move your body well with the deadlift technique, then you really never feel tight in your hamstrings, and there's never a need to stretch your hamstrings per se. What is the equivalent of that outside of the gym setting? Again, we just come back to our simple implements that you can find around the home. $5 from your local shop, your local Rebel Sport or something. This is called a banded good morning. Okay, it's applying a little bit of resistance to the body, but again, very simple. You don't need anything fancy. Okay, you don't need barbells, you don't need lots of heavy weights. And there's your banded deadlift, or we call them good mornings, banded good mornings, because you're doing a good morning, you're bending over to kiss your beloved good morning. Okay, neutral spine position. Okay, that's what is critical when you're doing all of these movements, and I'm sure I've made that quite clear throughout this seminar and this talk. Neutral spine position, which the broomstick helps us find. Okay, lets our hips move backwards from that center axis of our body, moving behind the central axis. All right, so that's your hinging, and of course there's many other variations of hinging. Once we start to get proficient, we could say, let's mix this up and create a little drill. And one really useful type of drill that we often do, we call them EMOMs, E-M-O-M, which stands for every minute on the minute. And you just set your clock up, and in 1 minute you might do a couple of front squats, 1, 2, okay, you set your clock up, you might do 2 pull-ups, 1, 2, okay, you might then do 2 deadlifts, 1, 2. That's your work for the minute. You then look at the clock and you go, all right, I've got 30 seconds rest now. So you rest for 30 seconds. As soon as the minute is up, you then go back into your 2 front squats, your 2 pull-ups, your 2 deadlifts, and then you rest again. So you can continue those EMOMs for 5 to 10 minutes, and I can promise you that by the end of that 10 minutes, even though you might have only done 30 seconds of work each minute, you will be absolutely puffing, and you can probably hear me puffing now just from demonstrating that to you. And what do we do if we don't have these fancy pieces of gym equipment? We could make up our EMOM with a couple of chairs on one end and a goblet on that end, and we might just do this type of activity. We might go, okay, let's do 3 sit-to stands. 1, 2, 3. Pop them down with good biomechanics. We don't round our back when we pick. We walk to the other side. All right, now we're going to do our squat and press. 1, 2, 3. We put that down. We come to our band and we do our pulling movement. 1, 2, 3. And we repeat that, and we might try to do that 5 to 10 times. Again, that might take us 5 to 10 minutes. But I can promise you that you're going to be feeling that, and in that 10 minutes you have created a level of intensity that is unparalleled when you compare that to going for a half-hour walk around the block, or a 1-hour ride, or a long, slow swim that is not driving intensity. It's not allowing your body to open and close. It's not using every muscle in your body, every joint in your body, the compound elements of functional movement. And as a consequence of that, you're not getting the neurohormonal secretion. And without the neurohormonal secretion, there is no physiological, or there is at least a lesser physiological stimulus to healing chronic disease, metabolic disease, and musculoskeletal disease. So I hope that makes sense, guys. A lot in that little demonstration, but it's anyone and everyone can incorporate movement proficiency and functional movements into their everyday life activities, and it doesn't take long. All the best. Okay, I'm sorry to make you sit through all that. So everyone tonight, we can all try to do some squats to your dining table chair, see how it feels. If it doesn't feel right, get in touch with us, please do. Last slide, conclusion. So health can be defined by elements that are free for all to embrace. These constitute the pillars of health. There is a powerful synergy and interrelationship between quality movement and nutrition. The medical industry can and must do better. As a discipline, an industry and a profession, we must separate ourselves from commercial conflicts of interest that have profit as the priority. This is an achievable goal, but pressure must come from the community through grassroots dissemination of fundamental, uncorrupted knowledge. And that's from you guys, okay? We've got to disseminate the information. No one else is. We have possessed this knowledge for millennia. It's just temporarily been masked by some sinister forces of greed, unfortunately. Thanks very much.